So good afternoon, everyone. Thank you for joining us on this live webinar where we are going to be talking about a variety of things, including leading employees in a broader context. We're going to talk about mitigating fear, kind of the transformation of technology, and we're also going to talk about the importance of budget and the kind of financial aspect of everything that is happening right now as well. So if you haven't met me before, I'm Mindy, Paulet. I'm Health and Wellness Advisor with Henriott Group. I work with employers to build and implement wellness strategies. Today we are broadcasting through Zoom and also Facebook Live. So those of you that registered through Zoom, we have some of your questions you've submitted in advance, which we will work out throughout the presentation here through the discussion. Through Facebook Live, if you have questions, you can drop those into Q&A. And of course, we'd love if you give us a little heart, a like, or a wow, as something that you thought was really interesting. So let's get started. So again, as we go along, please enter questions. If you're in Zoom, enter them into the Q&A function so that we can integrate those along as the discussion goes forward. And also, if you have questions, drop them into Q&A Facebook. So today I have the pleasure of introducing our panelists, which everyone here has 20 plus more years of experience in their field of expertise. So this is very exciting. So Mark Pettus, want to give us a wave, Mark? So.
Yeah, good to be with everyone, Dora. So my name is Mark Pettus. I am a physician, and my clinical background's in nephrology and integrative medicine, and currently I serve as Director of Population Health and Community Care at Berkshire Health Systems in Western Massachusetts. And I'm also on the faculty as an Associate Professor of Medicine at University of Massachusetts Medical School.
Very good. Thank you for joining us. Dora is the founder and president of GivingSpring. So she consults with businesses, nonprofits, and governmental agencies to build business strategies that create greater social impact and profit, which we'll talk a little bit about social impact today. She's one of the 5 certified shared value consultants in North America, which is very cool, and author of the book, Aspirational Businesses. So welcome, Dora.
Thank you.
And lastly, we have Brian Schroeder, who is co-founder and CEO of Preventia. Brian is an expert in building business strategies and programs around prevention, health promotion, coaching, and lifestyle medicine. Brian has owned or co-owned 3 small businesses in the Indianapolis area and believes in incubating business models that thrive on free thinking, innovation, and positive health outcomes. So welcome, Brian.
Thank you.
So we are actually going to kick off right now with you, Dora. I know you recently completed a white paper and on the future of work. So
yes.
As leaders are seeking to understand kind of what they need that they have and the expectations of employees, what are some of the most critical changes employers or leaders need to make to this going forward?
Yeah, so the report was really interesting. It had a lot of feedback related to what employees are looking for, not even just as we go through this sort of time of turmoil and crisis, but what are they going to be looking for on the other side of this? So it gives us an opportunity to be thinking about how are we blending the immediate needs of making sure that they're operating safely, that they have the financial and mental support that they need to get through this time of crisis. But as we get our arms around what these transitions are going to mean, what are they going to be looking for down the road? So we can keep one eye to the horizon, which I think as business leaders is really important. And the things that stuck out were really interesting. So it talked about wanting to be able to work in an environment in a business that had an ethical reputation, that had defined values, that gave them an opportunity to do meaningful work that impacted the world positively, and then also to be able to have effective and proven diversity and inclusion initiatives. So all of these things kind of speak to what we were talking about before the world went upside down. And really, I found them comforting to think that a lot of these conversations will be back on the table when we get our feet under us again.
Yeah. So as an employer, how do they kind of integrate some of those critical topics? Like people want meaningful work. So how do you create that in the workplace?
Yeah, and that is kind of a challenge sometimes, because especially if you're in a business or an industry that doesn't seem very exciting, we can make it kind of hard on ourselves to be thinking about what, if I'm making widgets, how does that impact the world? But we're forgetting that we operate in an ecosystem. And so even through our work, we're not only just providing jobs or providing a service or product for our customers, but we're operating in our communities. We're providing value for our customers that goes beyond just a quality or a price value. And we have the opportunity to not just give our employees jobs, but give them good jobs, right? And so if we just look at what we're doing now and think about how we could up the game and how we could have a vision of servanthood and what that would mean for all of our stakeholders, we can find a process, we can take action plans to move us towards businesses that automatically create that positive impact and meaningful work and drive value. They increase profit too.
So when you talk about a leader, like leading with social responsibility, what does that mean? So to an employer out there, what does that mean? How do they embrace that?
Yeah, so I have a model. I'll go through it very quickly. I won't, but basically the 5 things that you would need to do to build an aspirational business. You have a vision of servanthood that goes beyond just your customers. You have to serve your customers, but who else are you serving? You have to be able to measure what you're doing. So saying you're doing something and then not being able to measure that you're moving the needle is, kind of icky, right? That's a technical term. People will see through that pretty quickly. You have to be able to create an environment where your employees thrive. So you cannot build a positive impact business with meaningful value on the backs or at the expense of any group. Fourthly, you have to be able to meet all your ethical and regulatory requirements. And lastly, you market based on the truth of that organization. So you really have to be using all of the functions in your business to move it forward. But if we're doing that, it's really not rocket science. There is a process to doing it. It's using business the way it's meant to be used and just thinking bigger about what we're doing in our roles.
Okay. So one of the questions that was submitted earlier from a participant, and maybe Dora, you might be able to touch on that, and Brian, you as well. So the question was, how can organizations take advantage of their existing leadership coaching offerings and apply this to a greater number of people managing through stress and fears related to work, family, and their communities?
I'll answer quickly, and then Brian, I would love your thoughts on that too. So as I was reflecting on this question, I was thinking about, what they say when you ask a question in a group, that if the one person who asks it, there's probably 10 people who are thinking it, right? Yeah. So if we have one employee who says, I'm struggling here, or I need this, that of course that person is an individual, but there are probably 10 others who need the same thing. And so instead of just dealing with that one person as a one-off need, let's look at that collectively and think about how we implement that, through processes or approaches in our organization. The other piece I was thinking about with that question is that there are people out there who are already providing these resources. So you don't have to recreate the wheel. Everybody in a leadership position is asking these same questions right now. So go use your network, find people who are publishing content. Don't feel like you have to be the person who creates it, because it exists.
Okay. Brian, what are your thoughts?
So if we're speaking about leveraging leadership or having leaders, helping them focus more intently on the world that we're living in right now, and how do we remain connected to the things that we were doing previously, especially when it comes to wellness or employee engagement or mental health or whatever the actual initiative might be. How are we going to pivot right now? How are you as an organization or as a leader going to pivot in a manner in which keeps the ball rolling and remains in place during a time of such turbulence? There is a huge necessity right now for us to think very intentionally about how we're not only going to remain connected to our employees, but those efforts that we've been, maybe there's a lot of momentum that you've been gaining as an organization. You've been making some progress. And I think a lot of leaders right now, if we're speaking specifically about leadership, are pivoting away from something that they should be pivoting towards. They're not, there's not something, I'm not feeling the voice of the employee right now as a leader, maybe that I felt before, and hearing that my employees are potentially starving for these programs. So in some ways you're seeing people pumping the brakes right now, where maybe they should be hitting the accelerator a little bit and investing more deeply in these types of programs that are protecting our employees. If ever there were a time for us to be socially responsible, it would be right now. The decisions that we make today are going to define our brand for a very, very long time. And divesting in programs that are going to be particularly beneficial for those that we care about most is of the utmost importance. So I would say it's time to hit the accelerator right now and really focus on what's important. And getting that buy-in from the employees is going to be more important. So as a leader, listen right now. Take the time as you pump the brakes to listen very intentionally to what your employees are crying out for and really need.
Mm-hmm. And Mark, I know in a discussion we had the other day, you kind of talked about leveraging those strengths of employees. Is there anything you want to add along that lines? Would that integrate here?
Yeah, I mean, I really echo all that Dora and Brian shared. I think these are such challenging times in terms of managing emotions and the extent to which emotional and social intelligence are more important than ever. Really being attuned to the mindset of those that you are managing, leading, in relationship with, serving, and the extent to which I think we're all challenged to find a way to remain in the eye of what has been a very prolonged storm, become sort of paramount. And I do think the opportunities, as Brian alluded to, are probably greater than ever right now, given the sort of global awakening of the importance of resilience and how can I create an environment that will enable growth and evolution, without overlooking the fact that a lot of wellness programs are going to be seen as disposable commodities. And so I do think Brian's point is very well taken. And that, I think, is the challenge of us leading organizations and those of us in the wellness and caregiving space that need to remind others of the tremendous value of this work.
Brian, when we look at mental health, so what do you see, that's really bubbled up a lot. We're hearing a lot about that right now. So how do you see people, the successful employers, really engaging with that and running with that and taking care of people?
Super loaded topic in question. Mental health right now is so much. I want to stay away from saying that it's more important than it was before, but it is extremely. It's really been brought to the surface in a way that people are having to adjust to a new reality, a new manner in which they work. There's this migration towards this remote workforce right now. And what a lot of people are finding is as they adjust to that, they're actually spending more time working than they were before. Their work days are more intense than they were before. There's no time to commute and reflect. There's no time to step away from your desk and maybe take a walk, even though there is, but you're at home. You just feel like you roll right out of bed and you hop right to the job. And that creates a lot of anxiety and a lot of stress for these remote workforces, and the uncertainty what the future is going to bring, and what your job might even look like brings additional anxiety. The other side of this is those that are out in the fray every day, our first responders, our police, our fire, those individuals are suffering from all kinds of anxiety that are related to COVID. So I think right now, mental health, we as wellness vendors, I'm speaking from the perspective of a wellness vendor right now, whereas before I was living in a different world in healthcare, we need to think about how we can bring value now, today. If mental health is such a pain point right now for your populations that you're working to serve, and traditionally you might have been bringing value on the wellness component, how can you pivot a little bit? Just like we talked about pivoting as a leader, how can you pivot as somebody who's bringing value to focus on things like that? Maybe mental health is the thing right now. It is a very, very integral piece to what I believe to be a very holistic model of wellness, and often very forgotten. And it needs to be inclusive. And what you're seeing with a lot of vendors that are out there, where they're going to their EAP. And when you're looking at your EAP vendor, so important to have that right now. Very underutilized, but right now it's been accelerated. It's been brought to the surface. So you're seeing this oversaturation of your EAP vendors. So as an employer, I'd be looking very closely at what other services are out there that might supplement that. Right now, EAPs are just getting slammed, and you can't go to your counselor right now because the risk of venturing out is so high. Even going to see people in person is really tough right now. So I think it's important, both as a vendor, as an organization, to think very, very hard about what might you be able to do to bring value in mental health.
Mark, from your perspective, do you see that with the pandemic happening and the mental health kind of bubbling up, are you seeing any reduction in stigma around mental health? And then the other question I have is really around substance abuse, just hearing that people are coping more with alcohol or drugs, and how do you see that kind of impacting us going forward?
Yeah, really good questions, Dora. You know, I think we all know there's an abundance of data now suggesting dramatic escalation, 200 to 300% increases in what we know to be issues of mood disorders, anxiety, substance use. And one has to be mindful that this is pervasive and will affect everyone. And so I don't know that the stigma has changed substantially. I do think there's much more awareness of the importance of psychosocial dimensions to our lives. You know, most of us are challenged with it in some way, and I do see it as a more explicit agenda item. And whether it's how to best support your workforce or how to best understand the environment that you're in. I'm working right now with a lot of organizations, from banks to schools to manufacturing. And many of the drivers right now of the depression and anxiety and substance use really revolve around just a profound level of fear and uncertainty. And one of the things that I have found very helpful is when you're working with a business leader, HR leadership team, as they begin to have some perspective on what COVID is in their community, in their ecosystem, what the infrastructure is that is available to them for testing, for contact tracing. I don't want to get too far down because I know we're going to come back to this, but I do think there are opportunities for leadership to engage in resources that are available to them in a way that can help translate in a bit more balanced perspective what the risks are, what are being done to mitigate those risks, and how the many questions around testing and reentry can be structured in a way that can promote not only a safe environment, but an environment that people can feel comfortable in and safe in.
Yeah. So when you mentioned kind of contact tracing and all of that, kind of the future of that, I mean, because we're seeing, I think, a lot more than technology use just across the board. So what are you seeing from your perspective where things might be shifting into the technology space that before maybe were a face-to-face?
Well, I can start because I know Dora and Brian will have lots to say about that, but certainly in traditional healthcare, the telehealth platform has just accelerated. This is certainly, if there's a silver lining, I think we've leveraged technology in a way that we probably should have been doing long ago in an effort to connect with those we serve. And whether that's through meetings within an organization, or it's from a healthcare perspective, how we connect and engage the communities that we serve. So I think that platform is very much here to stay and is going to continue to be central to ongoing evolution of what the workplace looks like. The other thing that I will say is that I do think COVID has, again, if there is a silver lining, awakened a collaborative necessity in every workplace. In this environment, we are all stewards. We are all stewards of health, wellness, and the capacity to thrive. And so I think as workplaces begin to appreciate that there are constituents that maybe historically they've been disconnected from, maybe their boards of health, their departments of public health, their local healthcare systems that provide the infrastructure in the markets that they are in, the more they can begin to understand how those pieces in this new world order can inform not just the environment, but how it can inform the sharing of data in a way that will allow rapidly changing information, again, to be translated in real time with some balance and some perspective. And I think the data And the data that many businesses are going to be interested in may look a little bit different than what historically has been the case.
Yeah, I love that. I love that. Brian, how about from your perspective?
You know, technology, that's the business that I'm in, technology. And I find it interesting when we think about, how do I frame this? When we think about what's the difference between telemedicine and telehealth, and I'm trying to think about the audience today, you know, who is really watching this webinar and taking this information. And as an employer or as a broker, I think it's important to understand that there is a difference between telemedicine and telehealth. Telemedicine is going to tend to be more clinical. You know, you're going to be thinking about the interactions that you're going to have with your primary care provider, perhaps your doctor's appointments. Telehealth is more all-encompassing, and I think that what technology has provided us with through telehealth is an opportunity, whereas before it's kind of lurked on the sidelines as this, you know, this afterthought that brings both cost efficiency, you know, and effectiveness. As you're seeing it start to pick up, there's a lot of different ways to leverage a telehealth tool, which is typically more non-clinical, and do things like build integrations into an interaction with a provider who might be a dietitian or a health coach or a mental health provider that can work within all the other different technologies that integrate with a tool like telehealth to track your steps, to look at your remote monitoring devices and your blood pressure and your Bluetooth, you know, scales and whatever that might be, and bring more of a holistic solution. The other thing that it does is it allows us to enhance our access to care in a way where it's very much needed right now, because it's, again, dangerous to venture out right now. So how do you leverage tools like this as an employer, connect these tools to your populations where they can leverage the power of technology to remain connected, not only to their primary care provider for telemedicine, but also to your ancillary service providers that work within telehealth, and make it sort of this engine that goes round and round. This is not the end. I had somebody the other day mention to me they're so happy that COVID's over. And COVID is not over. And, you know, we're opening up businesses and we're seeing the economy reopen, but COVID is far from over. And we're beginning to see this reacceleration of COVID in many areas right now, where we need to remember that these tools right now are important to leverage. And we're in a crazy environment that we don't know what the future really looks like right now. And leveraging the power of this right now is going to be particularly important.
Mm-hmm. All right, Dora, you're up. What would you like to add?
Well, those were incredible points. So not necessarily a lot. I had a dream last night that I was on a Zoom call, so I don't know necessarily what that says about my own mental health, but that's the reality these days. I think what I would say from the COVID and the use of technology is that, to me, the way that we are operating now and what this has brought to light is, and I already said this, but how closely we are part of an ecosystem. So I heard at a wellness conference a few years ago that one of the best indicators of my health is my neighbor, right? And the community that I live in. And so it takes us out of being just solely aware of what Dora needs and what Dora's family is going through right now, and really what's happening in my greater community. And so as organizations, we need to be paying attention and addressing those immediate needs. We also cannot ignore the communities in which our employees are living and existing, and that we serve. And you see that in everything happening around us. One of my friends joked the other day that I had said people are paying attention and they're listening to what we say and paying attention to what we do. And she laughed and sent back, "You're right. When was the last time I read a letter from the CEO of Kohl's?" Right? People are paying attention. So we have to be thinking as leaders about how are we responding? We need to be paying attention to what communities are asking for and what they need. We need to be thoughtful about our action plan to address those things. We need not waste time trying to create them because they exist. And then we need to make sure that we're communicating to everybody in our ecosystem about our plan. And as much as we can, Mark, to your point, reducing that uncertainty, right? We may not know what's going to happen to COVID in the next 6 months, but I do know what's going to happen. If I go to this location, I know what to expect. So I think those are important points that we can use technology to help us with.
Do you mind if I respond to that just briefly?
Yeah, please.
So one thing that I love the points that you're making there, especially the the reference to when was the last time you read a message from the CEO of Kohl's, right? I was in a meeting the other day. It was at the Wellness Council of Indiana. And we were talking about the framing of messages right now for employers. And there was a really great point brought up by one of the fellow board of advisor members that said, be really careful about how you frame your messaging right now when it comes to COVID, because everybody's framing messages around COVID right now. I think as we create some of these interventions or bring, we make our small pivots and we attempt to bring value to employers, it's not a bad idea to kind of stay away from it a little bit. Stay away from the negativity that's associated with COVID. It's not all COVID all the time. There's a lot of positive things that you were doing before that this occurred. There were a lot of initiatives that you were focusing on that were for other reasons that were not about COVID. How do you remain consistent with that within your brand and keep the message positive right now where people really need it? Not everybody wants to hear about what you're doing with COVID. It's important to message it and to get it out there, but then get back to your core. Focus on what it is that's really important to you as a business and really, really hone in on that. I think it's important. And I thought that point was really well taken at the council last week.
I completely agree with you. I would add also, it's not about the message, it's about proving the action. So if you're saying something that's not true to your organization, you're just asking for trouble, right? It's got to be authentic, and you got to be able to prove it or prove that you're going to do it in the future.
Part of your model, right? What you said earlier, you said market the truth. So create these, you create these solutions and don't get the wrong message. You got to stick to your guns. So love the model.
Thanks. Thank you.
All right, we'll just pause here to remind people, if you do have questions, please drop them into the Q&A. And if you're on Facebook Live, drop them into comments, and we would love to hear those. So I'm going to pivot us just a little bit. And Mark, I want to ask you about, so kind of the future or the transition of, provider office. So we're seeing telehealth kind of skyrocketing. So what about those like small provider group offices? I mean, how does the impact of how they move forward impact maybe access to care? Or also along those lines, how is COVID, in your crystal ball, going to impact our healthcare costs going forward too, as we kind of transition into financial and budgets and those types of things?
Yeah, it is a very challenging time for the small, independent, private practice.
Yeah.
And as challenging as it was before COVID, just in terms of the economics of needing to maintain an infrastructure that in 2020 allows you to track what you need to track, report what you need to report, is a very challenging proposition. COVID further reduced, of course, engagement and interaction. For many of our practices, it took a while to really get up to a level of telehealth where they could begin to see more interaction and offset that tremendous drop. But we know that there have been dramatic declines in engagement, and many practices have had to lay off and furlough their employees. And I'm in a community where a lot of our smaller practices have had to become part of larger hospital-based system physician enterprises. And I anticipate the recovery from this for many currently independent small practices may accelerate the need to do so. There's certainly a lot of ongoing navigation in terms of setting up offices in this new world order, preparing for testing and what do I need for testing in terms of ventilation, and just sort of blocking and tackling operational issues. And then I think there's I'd like to believe as a population health person that all of what COVID has magnified, the extent to which comorbidities, diabetes, being overweight, having cardiometabolic risk factors is definitely the condition of the host that makes more likely a more significant complication from COVID in that example. True of any infection, true of influenza, things that have been around a long time. But I do think there's an awakening of the importance of driving to the extent that one can, more community-based models for reducing these critical risk factors. And I think the extent to which many markets now and many healthcare systems and practices are needing to partner with more non-clinical community-based organizations in an effort to achieve that engagement and those outcomes, I think is greater than ever. And I think that's a very positive thing.
Mhm.
And I forgot your second question.
It was really leading into that, like, so healthcare cost. So it sounds like engagement has dropped down. So are we looking at, do we think, and also with kind of the heightened awareness of those comorbidities, because I think people are thinking about that now, like, wow, now that I'm overweight or I'm part of that metabolic syndrome case, I could be sicker or I could die, whereas someone else couldn't. So
Yeah.
those kind of elevations of concerns, do you think we're going to see kind of that engagement skyrocket the other direction?
I mean, one can only hope. But I do think this is an opportunity. Many employers now are probably realizing significant savings if they're self-insured organizations, because many of their employees probably have not engaged the systems of care that they would have otherwise. And it'll be interesting to look at that data. I would speculate that per member per month claims in many organizations have gone down dramatically over the last few months. Of course, we all recognize that will likely then have the consequences for many reasons that we could spend hours talking about, of enhanced risk and a need for more expensive care down the road. And so I do think that the economics of this, and of course, depending on how state and federal government support, can help keep this behemoth moving forward, is going to force a lot of health systems and practices to redesign, to become leaner, to maybe focus on what those core services are and the markets they're in. And some pruning is likely to be a consequence of all of this.
Okay. So we have a question that came in that's asked, what trends are you seeing as it relates to leveraging my health plan data to make plan design decisions to accommodate telehealth and ensure that employees use the services? And secondarily, what are some of the creative ways to provide meaningful behavior change?
Goodness.
I can read.
So I love this question. The power of analytics is very interesting to me, and I'm going to even back up a little bit. Wellness has been seen, when we think about adopting a wellness program, for a very long time, it's been an afterthought. It's been, let's designate wellness to an HR professional, perhaps, who maybe has extra time on their hands, and hey, by the way, let's do wellness because we need to check the box, right?
Mm-hmm.
And I think that this is an opportunity to go back to even one of the earlier questions for leaders to take it seriously and make it a piece of your business strategy. It really should live in a world of business strategy, in my opinion, or at least in population health, but not everybody has population health because we're not all health systems. Mm-hmm. And when it becomes a piece of the critical business strategy, the way you lay it out, step A, look within the data. Analytics providers, as everybody, all the brokers who are listening in today know, and a lot of employers, there's a dime a dozen. There's a lot of them out there. We all either have our own or we work with another one. And there's a lot of power in the analytics and in the data. But you have to know how to make that data actionable. You have to have a good consultant to help you work within the data. And Dr. Pettus on the call today, of course, will be one of the first ones to tell you, when you look within the data and you're looking at applying a wellness solution or a lifestyle-based intervention, perhaps, you're going to be wanting to look at those within your own population that are cardiometabolic, co-prevalent with anxiety and depression, and perhaps some social determinants of health as well, and then dig even deeper and say, okay, of these people, which are perhaps most remediable through a lifestyle intervention? And then you apply your intervention. Then that's how you get very laser focused on creating a wellness or population health strategy that's going to have a meaningful impact. one-size-fits-all approaches don't work. They can be good for engagement. They can be good for a number of reasons for participation, but you need to be laser focused and look within the data and analytics to apply an appropriate intervention that's going to actually have health outcomes or an impact. For me, I see the data as a starting point. So love the question. I hope I answered it, but I'm not sure that I did.
Yeah, I mean, I would echo that, Brian. I mean, good health is good business. And I think that that proposition has become more apparent. What was once maybe an ambiguous cause and effect is much more clear now. And so I look at most, for example, self-insured organizations as ACOs. They pay for the care. They're in positions of being able to participate in the management of that care. And, to Brian's point, data should definitely drive a lot of that. Now, I do think that the emerging evidence and evidence that's been around for a while would suggest that you really need many options that you can sort of tailor to individuals within your organization. I think in principle, they should be holistic. And I will also say that on some level, and this might require a champion within the organization or some champions that model behaviors, or if you're partnering with the health system to provide services, those caregivers that really embrace lifestyle and lifestyle medicine and walk that talk, because we know lifestyle drives most of chronic complex disease. But I do think it requires sort of bold willingness to sometimes jump off the template of traditional sort of guidelines and one size fits all. These should really be, I think, tailored to sort of individualized programs. But a lot of what I develop here and in our market are heavily skewed toward nutrition, towards circadian entrainment, sleep hygiene, obviously stress reduction. They're group models. We know that the group dynamic, more virtual than FaceTime now, but even then, I think when you bring people together, a lot of the evidence would suggest that you're more likely to leverage change and to provide some needed support. And I do think, and I know all companies struggle with this, is where in the balance of structures that incentivize beyond just showing up, where can the incentives perhaps be shifted within the regulatory environment that a company and an HR director is in, that might begin to move a bit more toward outcomes? And how can our employees be rewarded for more than just maybe filling out or participating in a health risk assessment or just showing up to a couple of workshops? And I know that's a tall order, but I think the structure is important, and the content that is delivered really should be state-of-the-art, vanguard, and apply very much to the core issues that you're trying to address.
And some would argue that incentives don't work. And I've read plenty of papers on this, and incentives don't work, and I would argue that they do, but it's meaningful incentives that work. So marrying together your very meaningful and vanguard effort, your program, together with meaningful incentives. Don't hold back on the dollars that you allocate towards that, but make sure that the incentives are tied directly to the mission of what you're trying to accomplish. Giving people incentives to go cash them in at Home Depot is not as powerful as perhaps providing them with a healthy meal. Things like that are where you get really creative and can be very, very meaningful. So I thank you for what you referenced there when it comes to the incentive structures that are important.
So Mark, since it sounds like you have a nutrition focus there, can you talk to me a little bit about what role does food play kind of in a holistic approach?
Yeah, thank you, Mindy. And I know Dora, I think, had a comment around the last conversation. So I'll just quickly say that the food is medicine philosophy, which is hardly a novel philosophy, it's been around for a few thousand years, is more important than ever. And I do think that it's one of the areas where one can achieve the greatest traction and magnitude of change per unit of time. And I think there's sufficient science now to help guide strategies that do not leave people feeling deprived, overwhelmed, hungry all the time. And an example of that, Mindy, might be, so we have a program for our employees with cardiometabolic syndrome. So many of them are struggling with weight and are insulin resistant, pre-diabetic, diabetic, hypertensive. So we know that carbohydrate restriction, with or without keto, but the fact that we can even talk about ketogenic diets in a more traditional health model is a novel sort of concept. And you know, I think these are powerful, powerful programs. And while there are many ways to get from A to B, I do think that those implementing these programs and those facilitating these programs have more good tools than ever to help them be successful.
Mm-hmm. Dora, did you have something to add? I'm sorry, I mean, skipped over you.
No, it was good because I didn't actually have a lot to add, but I thought it was really interesting. Brian, you mentioned earlier the idea of this being part of a business strategy, and then Mark, you talked a lot about the metrics. And so I think as leaders, it's important for us to not just say, what are we doing, right? We are offering the program, but also are we moving the needle? So traditionally in the past, we might say, well, we've got this program, but people aren't really using it. If we are implementing this as part of our business strategy, then the responsibility on us as leaders is to then say, people aren't using it, why not? How do we adapt it? How do we make sure that we're incentivizing the behavior that we want because what we're doing isn't working? So as we look at measurement, it has to be not only what are we doing, but are we actually moving the needle? And if not, we have to figure out what we're going to do to change that. Because to your point, wellness is beneficial for business and our bottom line.
Yeah, great, Dora. And to dovetail something Brian said a little while ago about the data, employers can certainly get data in a very specific sense of what's driving their costs. In the example of weight and insulin resistance, we know one of the major cost drivers is insulin in our organization, true of many organizations. And so we're able to show our HR director, we're able to show some of our local business communities that contract workplace wellness services with us, the impact that our programs are having on reductions in insulin use, your reductions in A1C, sort of traditional measures, but we're able to help extrapolate what that looks like in terms of cost savings. And you get somebody off insulin, and that is a huge, huge cost savings. And then we know that can be extrapolated to many other potential savings along the way. So I think the more specific one can be in terms of the data and what they're measuring and how they can translate that to make a value proposition in terms of cost containment is really, really important.
So if we could spin back around to the cost. So we're talking about a lot of things like cost savings or incentive structures. So how, at this time, seeing groups and employers where budgets may be cut or they might be reduced, how can an employer embrace some of these changes and the social impact and, improving healthy lifestyles and all those, how can they move forward doing that with limited budgets? Ideas on that?
I can jump in on that one quickly. So one of the things that I've been working pretty diligently on over the last year is really proving how the math works to show that businesses that are engaging in the community do drive bottom line profit. And I've been able to prove that. So there's a 71% greater likelihood that if you engage meaningfully in the community, you're going to outperform your peers. And the numbers that we're talking about are huge swings. 32% greater return on equity, almost an 80% greater net income swing between companies that do this versus companies that don't. So the data is compelling. But here's the deal. This doesn't have to be a huge investment. Most of us already have what we need at our disposal in our businesses. We just need to figure out how to unlock the vision for what we really want to do as a collective organization. We need to take the time to measure it. We need to make sure we're listening to our employees and giving them the resources that we need. We need to do what we need to do to be good, ethical stewards of the community. And then we just need to communicate what we're doing. This is not rocket science. It's just about using businesses to do what they're already designed to do. right? And we usually have all of those resources already in existence in our business.
Brian or Mark, what would you have to add?
I say do what you can right now. You know, this world is full of payroll protection program loans and SBIC survival loans and anything else you can think of right now. You know, I think everybody acknowledges these are tough times. And while I don't feel that we should be focusing on completely divesting in these programs, the time is now to show your employees that you care and that you're willing to continue doing these things if you have the capacity to do so. But perhaps there are ways within your budget that you could just get a little bit more creative to make it affordable. Maybe you focus a little bit more on incentive strategy. Maybe you focus a little bit more on EAP. It just depends. It's a tough time. And a lot of budgets are getting cut right now. So focus on the long game. You know, I would think about what is the long-term strategy? Is this an opportunity to step away from what you've been doing for years that maybe wasn't working and you were investing in it, to really reflect and start planning your long-term strategy? Just like any business is rebuilding their business right now and thinking about their long-term strategic plan, start focusing on it that way. It is a long-term strategy. And if you put the deliberate effort and time into thinking of it that way, I think you'll come out ahead a couple of years from now. It doesn't mean you have to do it today, but maybe you need to start planning today.
Mm-hmm. Okay.
Yeah, that made great comments. Very, very little to add other than I think we just want to dovetail what Dora said. I think that leveraging, you know, if you have people within your organization that are champions that, you know, can share a little bit of their strategy and their knowledge and skill, very helpful. Starting a meeting, even every meeting, with a 60-second breath, pause, guided imagery, you know, leveraging those things that are right there and available to us, getting more full spectrum light whenever one can, whether it's through their open office window or being outside, and also very powerfully therapeutic. And I think there's just this general pervasive challenge of creating as much relationship capital as one can. I think we're all going to be challenged to really explicitly address our relationships, how much we mean to each other in the workplace, beyond the workplace, how much we need to support each other. Empathy will go a long way to mitigate a lot of the fear and concern that will be out there. And, I think that fundamental piece is important. It doesn't require programs to be building trust and relationship capital within your organization. And I think there are many threads to health and productivity that would come as a consequence of that.
So one of the things I want to talk about a little bit about, you kind of mentioned about empathy and things like that. So how can an employer help with employees that are living in some extreme fear at this time, fear and anxiety? Like, are there actions or things that they could do differently than we've talked about today to help with mitigate those fears?
Dora, do you want to start with that, or? I'm glad to.
No, I was thinking, I wish I knew exactly
Okay.
what the answer was. So please tell me.
Yeah, well,
because
maybe,
I'm
it's a huge question, Mindy,
Yeah.
For which there's no easy answer. I am very impressed with the depth of fear right now. And, from a neuroscience perspective, we've had a collective amygdala discharge. And I think the extent to which neuroscientists would refer to this as allostatic load. The environment has challenged us in an unrelenting way, and any biologic organism is going to begin to, dwindle under that. So I do think that understanding the extent to which COVID is driving that, I think requires a very clear understanding. And you don't have to have that as long as you have someone you can go to who can translate that. But people really need to understand how big the risk is. We know that 99% of people will come through this perfectly fine. We know that if you don't have lots of risk factors, the risk is very low. So I do think that helping people appreciate in a more balanced way where the risks are and what they can continue to do to mitigate it, why it is that a mask is important, and you know, what's available to them can go a long way to mitigate the fear. And again, some of that may require having someone from the local healthcare system come in, or boards of health come in, just to remind them of what's happening in their community, what systems are in place to manage that, how equipped they are, hopefully well equipped they are to manage that. And so that reassuring folks that there's no worst case scenario that can't be adequately navigated, I think can go a long way to begin to mitigate that fear. And then I think you just have to acknowledge it as well. You know, I tell people all the time that, you know, I share the same uncertainty you share. And I too have to be more proactive in recognizing when my cortisols are starting to, you know, hit the ceiling. And then when I start to look at the data and look at what's really happening and try to minimize some of the external hubbub, much of which is very much skewed in a negative way. It's a real challenge to turn off to the media, and, you know, but I think there are ways we have to create islands that we can retreat to that give us a sense of peace and equanimity, and that's doable. I think it just, people need help with tools to do that, and information to do that.
I think, Dr. Pettus, you're probably the only person I know that's ever used the word amygdalal discharge, but I know what it means because I know you, and I appreciate that about you so much.
Sorry about that. Yeah.
No, I love it. I love it.
It's a great Scrabble word.
Yeah, it is. I'll keep it up here for future reference too. And I think a couple things just to add to it. I'll go back to some comments from earlier. Providing education right now is really important. So, you know, leading with education so people remain up on what's current and what's important. But again, not focusing on it all the time. I think you can mitigate fear by sticking to your core business. Stick to the role, stick to what it is you're trying to do. You still have a mission as an organization that collectively you're going to be working together with your employees to execute. Focus on that mission, focus on the value that you can bring others right now that are also fearful. I think if you can get your mind off of it a little bit more and focus on your core mission, it's going to serve you well.
Good. So Mark, one of the other questions that we had submitted during registration and is related to masks, and I'm sure you've probably talked a lot about mask use, but this one specifically to like outdoors and exercise. So, you know, I've heard, you know, I'm an avid cyclist and I've been on the trail and I've heard people, you know, well, 6 feet isn't enough for cyclists, it's 65 feet. Or, you know, some people wearing mask exercising, but then you can't breathe. And so what kind of guidance can you help with that around mask wearing outside?
Well, you know, it's hard to find really good data to begin with that could form a more objective platform to be recommending. And this is an area where I think, you know, for every MD and PhD, there's an equal and opposite MD and PhD. You know, the evidence would certainly suggest, as we currently understand it, and as I interpret it, being outdoors, particularly if the nature of whatever it is you're doing outdoors is such that you can maintain a reasonable distance. You know, historically, the research suggested, you know, 1 meter, 3 feet. That some of that goes back to some influenza data. And then with the recognition that water droplet spread might extend, you know, it's about 90% will have fallen before it gets to that 6 feet point. And yes, there may be extenuating circumstances. Somebody is singing in a choir, that's been reported. Maybe somebody's doing very vigorous cardio activity so that their tidal volumes, these deep breaths might put some of that out there at a greater distance. But clearly being outdoors is a generally safer and has reduced environmental concentration for people who may be carrying this than what you would see indoors. We know that transmission to another individual requires not only much closer proximity, but much closer proximity over long periods of time. we're learning a lot from contact tracing. And if you look at a person who's positive and then contact trace their household contacts, you see about a 15% transmission rate. Now, that's very high for something that could be potentially very serious, but I think people are often surprised at how relatively low that is living in the same environment as somebody, with somebody who has it. So I would suggest that wearing a mask outdoors and with exercise is much less of an issue if you are able to manage some social distancing. If I'm outside with friends going for walks and I'm able to spread some, I'll take my mask off. And I think the evidence, at least to the extent that we understand it, would suggest that that is a very safe practice. And so, that's what I would say as of today.
Okay, thanks.
Yeah.
Well, it looks like we are, I can't believe it, already coming up on the hour here. So I'm just going to do a round robin here on what is one topic or area you feel would make the most substantial impact on employees to focus on now and moving forward for an employer. So what, of everything kind of they heard today, just from your perspective, what might be the one thing for them to focus on, and then maybe they'll come away with 3.
I wrote down a quote, Mark, I think this was yours, that there's no worst case scenario that can't be mitigated. And I love that, because the competence and confidence that we can bring to our employees and our communities through that, I think is so reassuring. And I think that is sound advice in my life and in my business and in business strategy. So I'm probably not going to tattoo it, but that'll definitely go on the wall.
Yeah.
I would say if there's one thing to focus on right now, I won't go the really the wellness route or the product route or vendor route. I think you should be focusing on, as an employer, what value you can bring to others. It's not, not just those employees that work for you and those that serve you every day, but what value can you bring as an organization and as a brand to your community? How can you be socially responsible right now? Again, I think this is the long game right now, and we need to be thinking about what value we can bring to others. It's going to serve us all well in the long run.
Yeah, well, great. I think, Mindy, I would just say that this is true pre-COVID, it'll be true forever, but just trying to create a culture of compassion. I do think that we're going to continue to be in a bit of a vulnerable place. Whether we acknowledge that or just hold it without acknowledging it is going to be the case probably for some time. And so behaviors are likely to come up. Conflict is likely to emerge. These are ripe conditions for interpersonal challenge. And so I think that the extent to which leadership can acknowledge that and foster a sense of compassion and a willingness to, again, create conditions that can leave their constituents feeling supported and safe. And, I think I just can't overstate that.
Mm-hmm. Very good. All great points. Great discussion today. I have one question that came in. I don't know if we can answer it quickly before we close, but this would be, Mark, for you. Comparing a face shield, is it as effective as a cloth face mask?
Is a face shield as effective as a cloth face mask? That's an excellent question. And it depends on the circumstances. So where a face mask is most helpful, and one might substitute face mask with goggles that are in contact with the face, so they're not allowing. That is most important when you are engaged with an individual that aerosolizes their water droplets. So these tend to be clinical scenarios where you're doing a procedure. You're likely to, whether, if getting a culture, for example, the coughing, that being in close proximity to aerosolized procedures is where a face mask or goggles will be most helpful. it's hard for me to imagine many scenarios outside of clinical settings or procedural settings where a face mask or goggles would add a whole lot to just a mask. So I think for the overwhelming majority, a mask with social distancing and obviously good hand hygiene is going to be sufficient.
Okay, perfect. Thank you. Very good. Well, thank you, panelists, and thank you, audience, for spending your valuable time with us. I know it's very valuable, and we appreciate you spending it with us. If you'd like to connect with me or any of the other panelists, please connect with us on LinkedIn and engage with us there. You can also follow us on Henriott Group. I will send a copy of Dora's white paper out to those that did register through Zoom, so you will get a copy of that as well. And if you're following us and watching us live on Facebook and you would like a copy of the white paper, you can drop that in the comment box. So everyone, be safe and be well. Thank you, everyone. We'll see you later.
Thank you.
Much.